Hi, I'm Wes with Capstone Retirement Solutions. And today's retirement solution, we're going to talk about our Part D, which is our Medicare drug plans. I often receive questions about Medicare Part D. Our medications can be a significant part of our financial resources in retirement. So, how can you find out if you're on the most cost-effective plan each year? And I'm going to walk you through the steps that I use to help clients every day. Starting off, you're going to need the internet access and your Medicare card. You're going to need the number. We're going to use Medicare's database. So we're going to go to there now. Medicare.gov. This is Medicare's database of their plans wherever you are in the United States. This is what you can access to find out about your drug plans and what's available, the different pharmacies that cover and contract with the different plans. And remember, this can actually be done every year between October 15th and December 7th. This is called the annual enrollment period, and you can swap these out each year during this period of time. You want to do this check every year because what's covered in these formularies can change during the year from each year from one year to the next. So you want to check this every year just in case something that's been well covered this year is not necessarily going to be the same in the next year. So let's take a look at this. On Medicare's website, you can go and get a drug plan by going to Find Health and Drug Plans, Find Plans Now, and click on it. Next, we're going to look at the 2023 plans here. If you need a 2022 plans, you click here on 2022. But we're going to look at the 2023 plans for this example. And we're going to put in, for this example, 76208 for our zip code plan type. We're going to put the second option, which is the Part D, and hit apply. Then start. Next, do you get help from your costs from any one of these programs? For most people, just select the bottom one, I don't get help from any of these programs. If you have Medicaid and low income help from these programs, extra help, you can select on those. But right now, for this example, we're going to use I don't get help from any of these programs and hit next. Now, do you want to see your drug costs when you compare plans? For this example, we're going to say yes. You can hit no if you're not taking anything and to take it directly to the plans. But right now, we're going to compare drug costs and hit next. And now, for this example, we got 2 or 3, 4 drugs that we'll practice and show what it would look like. So I just picked some, random drugs that I know I see that's pretty common. One, for example, is losartan. So I'll start typing in losartan. You'll see losartan potassium, and that's what you want to select. There, once you click on it from the drop-down menu, you hit add drug. And let's say you're taking a 50 milligram and not the common 100 milligram tablet. So you can select on the down arrow and select on your different dosage. And it populates the common dosage to a day, which is 60. And we're just going to leave that right now. And we're going to leave this frequency every month. Even if I get 90-day supplies right now, we're going to use that option later as we go research. Right now, we're just going to use every month so we can get a good look at the prices. I want to select add to my drug plan, a drug list. And you see right here, confirm your drug list. We have losartan potassium, 50 milligram quantity, 60, which is 2 a day for a 30-day supply. Then we're going to click add another drug, and we're going to put in levothyroxine. And you start typing it in. You'll see that selection. You can just click on it and then add drugs. And that right here, we'll just leave common. 50 mcg tablet and 1 a day, we'll leave at 30. Leave the frequency every month and add to my drug list. Next, we're going to add we'll do Crestor for a second here. You see that it populates. Crestor is a brand drug. A lot of times, once you hit add drug, it'll ask you like this here. A generic is available. And a lot of times we're taking the generic, but we don't realize it. If you want to add the brand, you can, brand name. But let's go ahead and swap it and add generic. Rosuvastatin calcium. We're going to leave the doses at 20 milligrams tablet, 30 milligrams, which is, 30 tablets, one every day. And we're going to add that to the drug list. Let's just use those three for example. Then we're going to go down to done adding drugs. So we've entered our list and we hit, if you had 15, 10, 15 drugs, whatever you do, you start loading them up, done adding drugs. And then it's going to just ask us to choose pharmacies. You can choose up to 5 to compare. Some good ones that I found in the area under 76208. There's Kroger, Walgreens. Sometimes you Tom Thumb, Walmart. Let's see, Walgreens and the CVS are very common. So those are ones I use most of the time to kind of give me a comparison. And I hit done. And it's going to come up with a drug list. So it's loading up in the database. So right now it comes up with a SilverScript Smart Saver PDP for 2023 with that list of meds. It's showing me I can have a monthly premium at $6.60 for the premium per month. And then my yearly plus premium cost is going to be $150.20. I do have a drug deductible on this plan, $505. That's potentially something that comes up that I may have to pay in the year where the plan starts covering some meds. So before we go into plan details, I want to show you with that same list of meds, if I go and I keep scrolling, you'll see that it gets more and more expensive for that same list of meds. You know, now this list from AARP, Medicare RX, Walgreens, $28.30 is $28.30. So for $394.44 with a $350 deductible, I can get a list of meds. So it's about $150 more in a year for that same list of meds. If you keep scrolling down, and you'll see that it just keeps getting higher and higher. If you go to page 2, you'll see that it continues to get higher on your list. So the most cost-effective one that we found, we're around here, it can be $1,000 for that same list of meds, right? So we're going to go back and look right here, the SilverScript Smart Saver RX. And this is the one that Medicare's database is showing that's coming up with the most cost effective for 2023. When I look at the lowest drug plus premium cost, it's filtering it with the least expensive or most cost effective at the top. So this is the one that Medicare shows does well with our list of meds, and we're going to go to plan details and pull that up just to kind of give you an idea what this looks like. This shows what you'll pay, $6.66 for a premium, and your retail $72. Mail order $68.88 if you use the retail. That's the 90-day supply that I was telling you about that we could use. On this plan, you'll see how Kroger, it's a preferred network. Walgreens is an out-of-network on this drug plan. Now, the different pharmacies contract with the different drug plans and what's covered and network and not network. So you want to pay attention to this. This is very helpful and kind of give you an idea what that would look like. Because Walgreens, if you use your meds, you love your Walgreens and you went down there to use your meds, well, they might just fill it. But it's going to cost you, let's see, the yearly drug cost, $4,934, give or take a few. Whereas if you went to Kroger, it could be $72 for the year. CVS, $72 for the year. Walmart's in network as well, a preferred network. $72, the mail order, $68.88. So this is how you can look at the different pharmacies and what's covered and what's contracted, what's in network, out of network, and a preferred network, which you typically could get better savings staying in a preferred network. If you scroll down here a little bit on this plan details, you'll see Kroger and about what you'd be paying monthly for that list of meds. $6.60, CVS, $6. CVS is $6. Of course, on 90-day supply, $17.22. 90-day supply. If you scroll down here more and you'll start looking, it talks about, and you click on this plus arrow, view more drug coverage, you click on it, and you'll see it talks about the tiers. Now, each one of those are tier one drugs. In this plan, those tier one drugs, looks like it's not going to go toward the deductible, which is a nice place to be. Had you need to pay a deductible, you would pay the first $505 in a year for a med. Let's say throughout the year, you have a medicine that comes up through the year. Well, the plan covers it. If the plan covers it, you pay your deductible, unless it's a generic similar to what you have right here. If it incurs that you come across a med throughout a year that's not well covered in your plan, reach out to me. There's some other options that are available in the market to try to get lower drug costs, because there's not one of these plans that cover every potential medicine that you can have. And so they kind of have their own formularies that they change. And again, right now in 2023, there's 27 of them in Texas. There might be some different ones, of course, in Florida, Colorado, and other areas that you may be in the country. But this is the database that you can use. It's Medicare's database. They don't charge anything for it. The different plans are available, and feel free to use this. Again, this is a solution that you can use. If you were going to enroll in this plan, I would just go to this enroll button at the very top where it says enroll and join plan. And this is where you're going to need your Medicare number. And then it's just going to ask you your name, your address as you go forward. How do you want to pay? A couple of different options where you can do that. But then it'll share with you that as you fill out the application. The application is very simple. It should take you just a couple of minutes. Just remember at the very end when you submit, it's going to enroll you in the drug plan. That drug plan, when you submit, you want to look for the confirmation number. It should be available to you. With that confirmation number, if there's ever an issue, they're going to, that's the first question they're going to ask. What's your confirmation number? So you want to keep that for a couple of months. I will tell you, once you enroll, it usually takes about 10 days and they'll send you your card in the mail. So you'll know. If it's been past that period of time, you probably want to get on the horn or get on the phone and see if everything's okay and you got enrolled all right with the plan. Just don't assume. You need something that's proof to you that you're enrolled. So that confirmation number is proof. That way there's not any issue that you enrolled in the plan. The last tip that I'll share with you, because the word's not out on this, you can be penalized for not having a drug plan. All right. So if you're not taking any meds, I still would recommend to my clients to get the least expensive drug plan, so you have something in place, because you could be penalized for every month that you do not have a plan. There was a client that I helped, and she was 72 and she started Medicare at 65. And so when she starts paying for her drug plan, she's going to have a penalty that she won't outlive. Anyway, hope this helps you with your Part D solution for your retirement. And you can do this between October 15th to December 7th in your annual enrollment period, and you can change out these drug plans. And I encourage you to do so. And if you do need help, please reach out to me. My phone number is 817-829-2964. You go to my website at www capstoneretirementsolutions.com. Thank you very much for being and spending time with me. Take care. Let me know how I can help you.